started asking questions. And some of the things that came out, which people didn't really think about, was water does many things. All of us in our facilities cannot function without water. I guarantee you that if you lose water in your facility, it's going to be a short time before you're scrambling, figuring out what to do. Why? If you're a person that's getting bottled water delivered from a contractor, that's all fine and good if you're thirsty. But if you're flushing toilets, I guarantee you it's going to take a long time to open all in little bottles and dump them down the toilet to get it to flush. They didn't think about that. Those are things that weren't thought about. What does water do for us? And you take that one component away from our facilities and we're in big trouble. Water is an essential, along with power. Power is very essential as well. We learned some really neat things. We learned that water contractors, everybody was contracted with the same water hauler. What do you think that does if you have a city-wide disaster and you're all out of water at the same time? How soon do you think you're going to get water on the list? And the answer was, well, we have a contractor, they're going to deliver it when we want it right now. Well, I knew the water hauler that was contracted with, and he has 2 trucks. So, I mean, 2 trucks, and we have, what, 7 facilities in town? 7 different nursing facilities that need water at the same time. Not going to happen with 2 trucks. We need to look at our plans and revisit our plans. So we talked about revisiting our plans and what that means. So then we talked about if we have to move off-site, where's that going to be? And, you know, many of you have memorandums of understandings with other facilities that you can move patients to another facility up to a certain number if they have availability of beds. So that's good. And I'm going to point out right now that there's an MOU that was sent out to all your facilities by this group that we have not gotten back yet from last year's training. If you could go back to your facilities and mention the MOU, hopefully somebody knows something about it and we could get those back in here. And we're going to see the importance of that. Vicki has one in her hand. She's holding up.
What's an MOU?
It's a Memorandum of Understanding.
Thank you.
I'm sorry, I did mention that earlier, I thought. Here's the problem. I'm not a healthcare person, I'm an emergency person. So when all of you start talking in acronyms that I don't understand, I'm just going to go, okay. But I get it, Val. Thank you.
That's okay.
So, we talked about that. What brings us here today is that we saw a need, once we evacuate patients from your facility, say you can't take patients to another facility. Say Brother Care can't take patients to, say the whole city of Ashland is affected and Brother Care would need to take patients to maybe a facility in Mansfield if they had an agreement with them to take X number of beds over there. That's one thing, but say you can't do that. Say that we have a widespread event, and we've had some of those recently. We got to looking at needing one central point where we could evacuate patients to in a temporary setting. We're not talking about long-term here. We're talking about 2-3 days max if we have to. And hopefully in that 2 or 3 days we can work out some of those other details to move those patients somewhere else. But the reason we're here today is to talk about evacuations of extended care facilities. So we needed to look at different facilities around the county and see what was available that was large enough and had the facilities that if we had to move patients into to serve as a temporary nursing facility, what would that look like? And we looked at several locations around Ashland County. We looked at Dale School, which ranked high on the list because of a lot of the facilities that they have there based on what facilities they need for their current occupation. Obviously, a special needs school has a lot of the things that we need in nursing. So we looked at this facility, the Career Center, which ultimately was chosen, by the way. This site is the site that we chose as the evacuation point. We looked at Loudonville High School. We looked at the Croc Center. Am I leaving out one? There was one more, it seems like.
Kettering.
Kettering. We looked at Kettering, Loudonville. Obviously trying to diversify in the county so that if we had an emergency in one part of the county, we could move them to a part of the county that wasn't affected. Ashland County is 38 miles north to south in geographical distance. That's a lot. And there's a lot of things that happen weather-wise within that 38 miles, I can tell you. There's like varying levels across the county when weather happens and things that really affect different areas in different ways. But we're not just talking weather. We're talking, obviously, water. If you have a water failure, we're going to need to evacuate your facility over time. I'm going to use Samaritan Hospital as an example. We had a water issue, was it last summer? I've lost track of when it was. It was last year. We had an issue at the hospital where the chillers weren't working on top of the hospital because the cooling towers were empty, I believe, because there was a problem with the water supply filling the towers at that time. So we were down to the point of wondering what we were going to do with the hospital because there was literally water dripping from the ceiling in ED and in the operating rooms because of the humidity and things within the building. Obviously, that's not a sterile environment. You can't operate that way. What are we going to do? The hospital had patients in it. Obviously, it only affected the first 2 floors, I believe. Top 2 floors. It was the top floors and not the bottom floors that were affected. So we could still maintain operations in the first 2 floors of the hospital, but the upper 2 floors, we were questioning what we were going to do with those patients. And we met and we talked about if we were going to move patients, what we were going to do. We ultimately had a plan set up that finally we brought in fire trucks and we're going to pump water into the tower on top of the hospital in order to keep the cooling tower filled so that it would function and we didn't have to move any patients. But we did move some people around and shuffled some staff, as I recall, early. Not dramatically, but we were close. And then we had a great power outage incident at the hospital when the generator went, the backup generator failed. That was an interesting day too, because I can tell you, Samaritan is a wonderful place when the lights are on, but when the lights are off, it's a scary place because you can't see in the hallways. It's dark. And we had pregnant people who were having babies that we ended up taking down flights of steps on stretchers and moving them to Mansfield, I believe is where they went to at the time. So we did move patients. We actually literally moved patients. But we had a plan in order to do that. You don't just do those things and say, let's do this. Which brings me to my next topic. The reason we're here is to talk about evacuation points for your facilities. And it could happen to you. Don't think it couldn't happen to you. There's a whole number of things that could cause you to evacuate. So think about what those are. Think of your risks within your own facility of what could cause us to have to leave this place. What kind of things are there and what does our plan say that we're going to do? A month or so ago, we had a facility in Wayne County that experienced just this. They lost power. They had lost their primary power and their backup power had failed. I became aware of it only after I got a phone call from Vicki that said, do you know what's going on in Wayne County? By that time, they had already called people to respond to the incident. This was, I think, a couple hours in, wasn't it? Or at least an hour in. And this facility was without power, without backup power. Apparently no way to bring in generators at that point to generate power. So their choice was to evacuate the facility. Now, early on in our training sessions over the last couple of years, we asked you what your plan is if something happened in your facility, and the answer was, well, eventually it got to that. But in the beginning, it was, we're just going to call the fire department and have them come evacuate our facility. Sounds like a good plan, right? You can always count on EMS to show up and do what they do best. Then the plan became, we're going to call Mark. That became the plan. All of you wrote in your plans, we're going to call Mark. It's simple. Well, that's closer to a better plan than calling the fire department, because that's what the facility in Wayne County did. They called 911 and said, send me all the rescue squads that you have. That was the answer to their plan. Sounds like a good idea, right? I mean, if you're in trouble, you call 911 and people respond. What happened was we had rescue squads from all over Wayne County We had rescue squads from 7 fire departments, actually 5 fire departments, and then we had other equipment from 2 other fire departments responding to an issue in Wayne County.
From Ashland.
From Ashland County. Anybody see a problem yet? Nobody had called me yet, number one, and I'm the guy that's supposed to coordinate all this other stuff that goes on. They had basically not really notified the hospitals and places that they were taking these patients to, because they took them to hospitals, not other nursing facilities. They sent them to hospitals. Oh, did I point out that this facility also had at least 15 patients on vents that they had been bagging for over an hour with no power. It was hot, and I think what it came down to was they were tired. If you bag 15 patients for over an hour, your staff is shot. If you don't have a lot of staff to begin with, they were exhausted, I'm quite sure. So their answer was, call 911, send us all the squads you can in 2 counties. So firemen do what they do best. They get in their trucks and they rush to the scene. They rush over there, and there they were, which left Ashland County at the time very vulnerable to anything happening in Ashland County. Not only Ashland County, but Wayne County, because now you have all of your squads tied up in one event. If we would have had an incident in Ashland County, we would have been in big trouble, because all of our squads were in Wayne County, sitting around waiting to be told what to do. And that's only the beginning of the problem, because the problem just compounded as the night went on. So Vicki called me, I called the Wayne County EMA director and said, what do you know about this? And he knew that it happened, but nobody had shown any urgency to him whatsoever that there was a problem. And of course, by that time, after talking to Vicki, any of you that know me, I get a little excited when things aren't going quite right and should be changed. So I get on the phone and I call John, my counterpart in Wayne County, and said, you've got a problem, because you have a facility that's being evacuated and you're now sucking up all my resources in Ashland County. And I'm not very happy about it. So John says, I'll check into it. And he calls me back and he says, we got a problem. He says they're evacuating the whole facility. They don't know when they're going to have power again. They put everybody in squads and just sent them wherever, to the 4 points of the earth. Basically, they sent them to Lodi.
We did call hospitals and say how many can you take.
Well, they did. They called and asked, how many patients can you take? And I think Samaritan could take 3, if I remember. 5 patients, but only 3 with vents. 3 vents. If you got 15 patients on vents, that becomes another issue of where you're going to send them. Because obviously there needs to be a ventilator there when they get there. So 5 were coming to Samaritan. 5 more were going somewhere else. They sent them to Lodi, they sent them to Millersburg, they sent some to Worcester, they sent them all over the place. Now, picture your facility and your patients being scattered up, all points of the earth. Okay, that's good, but if I remember the night, and I was standing in the ED in Samaritan that night, the patients came in, we sort of had some information on them. We had who they were, and I think maybe what their health. Who they were, yes. Karen, thank you. Karen and I spent a lot of time together that night. Most of us were pacing up and down, passing each other. We weren't really talking, other than growing. But all we got was, this is who they are. And they came, this facility in Wayne County doesn't have the cream of the crop for patients. They came with a lot of issues. Most of the patients in this facility have serious health issues, socioeconomic issues, whatever. And they come with all of this stuff when they come to your facility. So they came in with names. That's all we had. No track. I don't know what tracking took place on the other end from the facility, if they knew what patient went to what hospital and how they were being cared for, because I remember a request being made for staff to come with a couple patients, and no staff really came with these patients. So they were just sent off to another facility with no staff that knew who this person was or knew what their health issues really were. Now you have a new patient, and all of you know when you take patients into your facilities, you do a pretty extensive search on